And there's a lot of really good things coming out of that research. It, however, excludes screening kids that don't have a sibling. So the Wendy Chung talks about that they actually believe that there's 200 to 400 genes that could be involved in having someone that will be diagnosed with autism later. But it's not random. There's patterns to it. So they're really looking at, is there a possibility of being able to screen kids based on what they know about those biomarkers? In that video, which I encourage you to watch because it's really cool, there's an old video of kids being screened based on their eye contact during, it's babies, infants, during a, so the child is actually put into this device, they're laying down like in a cradle, and their mom is shown through a video singing Itsy Bitsy Spider. And they're tracking the child's eye movement based on that familiar song and something that a typical infant would react to by shifting their gaze, looking at the parent, and then being able to then down the road know whether that child would receive an autism diagnosis or not. And the results of it are pretty cool. So like the children that they show, one child seems to focus on the mom's eyes, is shifting, is looking, seems to have some level of enjoyment with the song. And that child does not receive an autism diagnosis later on. Then they show another child who actually is focusing more on a feature of the face, so more down in the cheek or in the chin area, off to the side, and that child does receive a diagnosis later on. So it's pretty interesting. So then more recently, like this is very, very recent, in the last year or so, and even in the last couple of months, there have been lots of news articles about this, that there is a person, and I blanked on the name of the person, but a doctor who has started creating a treatment, a parent training treatment to get parents, it's basically interacting with their child in a certain way when they are infants in order to lessen the severity of a potential diagnosis down the road. So it's really interesting because I don't think it's a longitudinal study yet, but they're going to look at it over time to see if it's having an impact. But they're thinking that if you can interact with your child in a certain way, especially siblings, because it's a higher risk, that maybe the severity will be lessened over time. So that's pretty cool. The takeaway point is that early diagnosis is key because then you can access services earlier at whatever level the child needs. The biggest thing in the field of autism is evidence-based intervention. So especially in order to get your treatment funded or paid for through insurance. So the only treatment that is covered by insurance for treatment of autism across the country is ABA. Speech and language therapy and OT. Nothing else is covered. There are lots and lots of other treatments that are trying to get covered, but none of them have the research base that ABA does over time to show efficacy for treatment with autism. So it's a very expensive treatment, and that's why there are insurance legislators all over the country passing laws to cover this through insurance. Michigan has it. Not everybody can access it though, unfortunately, with the law, the way it's written. So in Michigan, it took about 4 years to get it. It was a long process. It was voted down twice. It passed on the third try. So yeah, that's a big thing. And there are still some states that don't have it. I love this website. I use it with parents, asatonline.org. There's lots of good stuff on the website, but the biggest thing that I use it for is I read about treatments on there and I keep myself up to date on the treatments that are out there, the research that is out there to support it or not support it, and the treatments that are not recommended for use, because there are 3 specific treatments still that have been deemed harmful that parents are still accessing that have been deemed harmful. So I keep myself up to date on this, and when I have families that are looking for information like that, I refer them to this website so that they can get themselves educated as much as they want to be on what's out there. Resources are minimal, so if parents are going to put their resources into something, they should get something out of it. Okay. So that's my autism section. Questions? Comments? Nothing. You're experts in autism now? Good, I'm glad. Yeah.
I actually have an example. My son has autism, and at 2.5 years old, I realized that he had a language deficiency. He did not get diagnosed with ASD until most recently because he didn't meet all those markers. He actually would look at the person that was testing him.
Sure.
So he got ruled out because of that, and for many years he didn't get the services that he needed.
Yeah. That's a really, really great comment and a really common thing that we encounter, because even though he may have met all those markers, honestly, he probably did. Yeah. Especially if he received it now. You're dependent on the person's ability in the assessment to recognize those, and then to give them some kudos, and they also are dependent on an hour to 2 hours spent with that child. So the changes in the DSM actually help with that a little bit, because now they can take parent report based on history. And I think that weighs a lot, because I see kids now that I don't know how they got a diagnosis. They definitely have autism, but it's very hard to see in a 2-hour block. I start to see things over time that would qualify them, so that window of time, but they got it because of parent report, because of the history of things.
We hear so many parents say, I knew there was something at 6 months, 10 months, whatever, and the doctor told me no. And I've even had parents say, when they've met professionals, just meeting, not even for an eval, if the child looks at them or talks to them, they say, he doesn't have autism.
Right.
He looked at me and he spoke to me. And
right.
It's so frustrating.
Yes.
I'm sure you know, but
yes.
So frustrating for parents because
yes.
they hear so many different things.
Yeah, so and unfortunately, especially with little kids, parents don't know what resources are out there. There is still not a good funnel of resources for parents to access to say, no, there is something going on with my child, and I am not going to listen to you. I'm going to contact this person and see what I can do. Parents are just left to the internet, and that is not always the best source. And unfortunately, that person that is supposed to be their advocate, that is supposed to link them to those services, is saying no. So yeah, it still happens. It's better, but it still happens.
At what point does a parent or a professional become concerned that there could be an autism diagnosis? I mean, some kids with a developmental delay may not meet the benchmark for all of those things, but then there's 2 things instead of 15 things. Where's the window in that?
Yeah, so with the new criteria with the DSM, it's actually a little bit easier, I would say, to qualify, for the diagnosis. Medical diagnosis is a little bit different than, so we receive kids into our program and they get a medical diagnosis, but what's required for that diagnosis is a little bit different than the process you go through for like private insurance. It's a little bit less, like they don't require as many tests. So if the family were to go through and maybe they had private insurance or commercial insurance, they would actually get a much more thorough evaluation than what we see coming in from providers just for the purposes of accessing the state's program. So you get a lot more different tests. They do a lot of cognitive testing and so they take all that data into consideration, not just the one autism diagnostic testing thing. So, one of the things I think you're asking about is what is the window for like, when do you access that?
Well, more so like, when do you become concerned? Because there's a child in my family who for years I've thought he's on the spectrum.
Yep.
Because I look at him and I look at all of his behaviors and it's classic, yet he's had psychological evaluations done, he's met with psychiatrists, and there's been no diagnosis, and yet there's like 8 different things that from what you've shared this morning, I was like, he meet that threshold.
I mean, I think you definitely be concerned if the child needs services. I think that's when the window opens, is So there are some kiddos that function pretty decently with just some intricacies. And maybe those intricacies get bigger as they go through time, and that window should have opened. And then the little kids, that opens much sooner. But if there is some barriers to that child being able to function at whatever age they're supposed to be functioning, whether it's academic, whether it's community living, whether it's daily living skills, if there is some sort of barrier that is prohibiting that kid from accessing the world in the way that they should be in order to continue to grow in those ways, they need to access some level of support.
So Beth, if a kid were in Kent County, like what would you say to people that work here that aren't seeing autism all the time? Where would you say that they should go? Would that be Network 180 for screening, or?
Well, it depends on what level of, like, what the payee is, or who the payer is for that family, because their route to get services would be different. So if they would need to access services through Medicaid, through a state-funded program, then they need to go through Network 180 in Kent County. And they basically just have to call the autism team. So they can call the main line for Network 180 and the access line and just ask for somebody with the autism team. If their insurance potentially could cover it commercially, they first need to call their insurance company and find out if they have that benefit. And then then they should be able to just Google approved testing sites in Michigan, because you have to be an approved testing facility in order for insurance to accept that diagnostic test. There's quite a few more of them now. And then they basically would just, if they have the benefit, they basically would just call and set up an appointment. They don't, most plans, unless they need a referral, can just call and access it. So, yeah. Did they answer? I'm sorry. Did they answer your question?
Yeah.
Good.
With autism disorders, spectrum disorder being diagnosed off of behaviors, is there like a set way to discern between like trauma and lack of exposure to normal developmental things versus the actual developmental disorder?
Yeah, so, and basically I think that would be through like rule out. So they would look at history and what has happened when the onset of the symptoms or characteristics occurred. So if like the onset happened at the time of trauma or shortly after trauma, those kinds of things, then they would look at both but start to gear in a different direction.
Okay, because my wife and I have a almost 6-year-old foster child.
Okay.
One of his main traumas is severe neglect, so like we have no way of knowing when the behavior started.
Okay.
Because parents weren't paying attention to developmental stages
Sure.
of what the kids were doing.
Yeah.
And so he displays a lot of the behaviors, but we have no idea whether or
So-
not that's.
And part of it would be, so for autism, you have to have all behavioral characteristics in all of those areas we talked about.
Mhm.
So you have to have the history, which you guys may not know very well, but you have to have, so you were talking about does he have behavior issues? Is that the primary
some
concern, or is it a lot of
sensory
sensory
stuff?
stuff?
But
Okay.
it all varies depending on the setting too.
Yeah.
So the behaviors are different. Like if he's
Oh,
meeting
interesting.
with somebody screening him, he acts much more
Sure.
like he is on the spectrum versus
Sure.
when he's at home with us
Yeah.
or his family. And
I mean, if you have a concern about autism potentially, then I would seek the appropriate person to help you get connected with to some level of evaluation, because the evaluators would be able to rule in and out those things and put you on an appropriate track. Because if some of these things are occurring, there are also just sensory related disorders, and there's also just behavioral disorders. But if all those things are coming together and working together, a lot of times then that would be autism. So, you had your hand up a long time, and then I'll.
What if, after the DSM-5, this happened in my family, they ruled out autism, did social pragmatic communication disorder.
Okay.
And then, a couple years later, there was a behavior that was just, that we realized, and we shared it with a professional, and their neuropsychologist diagnosed her with PDD after the DSM-5.
Yeah, they can.
I know,
No, and honestly, I have to be honest, I get reports from a local place that still use the old codes. Don't know how, because you're not allowed to. That can't even be put into insurance anymore. So, no.
That's one of the options I think for my daughter.
No, yeah, no, they can't, because that automatically shifts your ability to access resources, and those codes are gone. That code doesn't even exist anymore, and the code is what gets sent to insurance. So that's the qualifier. That's what they put into their system for paying. So, and that automatically, yeah.
Yeah, I've been confused.
The only thing that I would look at, that I don't know, but I think I'm right, but I don't want to say it for sure, is I don't know if PDD got moved into another section and still exists into another developmental delay section. So that's one thing that I would look into. Autism, autistic disorder, and Asperger's, those two by themselves went away.
Well, and
It's my understanding that PDD and OS and autism and Asperger's got lumped into the same category.
what I was told by a psychiatrist was she probably would have been diagnosed with Asperger's had we done it at age 2 when the professionals were telling us she's too social, she can't have autism because she's social.
You need to go someplace else. Because if she would have been diagnosed previously with Asperger's, then she still would qualify for autism, for ASD. Yeah. Seek another referral. Your gut instinct is right.
With foster kids, that a lot of us we're doing foster kids, sometimes there's not, the history is just not available, like parental rights were terminated.
Yeah.
And the kid's 13 now, and we have no idea what the history was.
Right.
At 2 and 3. Can they
Yeah.
still, like, how does that work?
So, I mean, I think that then they have to probably make a judgment call. I haven't received any diagnoses that would have indicated that they still gave a diagnosis, but history is history. So if you've known the child for 2 months and you've seen it across 2 months, then it's persisted for 2 months.
Okay.
So if you've known a child for a year and you've seen it for a year, it's persisted for a year. So that's the history.
I just know, like, the onset seems to be really important from what I'm understanding.
Yes and no. I mean, so really you want to, so the history is important for the diagnosis, but they don't say, did it occur at 2? Did it occur at 3? The interview for the person who's doing the interview portion of it, they might ask questions about that far back, but if there's no answer, then they take the most recent history that's available. So the onset is not a qualifying criteria, though. It does not have had to have occurred at 2 or 3 or 4 or 5. So it just is, like for me, it would just be, oh, okay, I mean, this child probably could have been diagnosed a long time ago, but for our purposes, it doesn't really matter. So, yeah.
So we've discussed how important it is to get them and like evaluated early on. What about kids who don't get evaluated until they're like 17, 18? What's the benefit and not benefit of
Yeah, I mean, it is what it is at that older age. So she said, what happens if the child didn't get diagnosed at a young age and now is a late teenager or an adult getting a diagnosis? Yeah, it is what it is. Services will still help. If you are accessing, let's talk about ABA just a touch. Let's say the person would benefit from ABA. ABA is for every age range. There's a misconception that it's only for little kids, or if it's only for, it stops being beneficial. As long as you have a good provider who knows how to work with older kids, then you focus on what those kids, those older people should be doing, not on what they should have done in the past. So they should be working on whatever the deficit and excess areas are, whether it's daily living skills, whether it's functioning in the community, whether it's being able to order at McDonald's, whether it's being able to hold down a job, all of those things. ABA works on all of those things. So, but you have to find somebody that will do it in that way and find appropriate levels of service. So, did that answer? Okay. Was there a hand back there? No? We good? Okay. I don't know what that is. Random little thing. Okay, so let's talk about behavior.
It's back.